Welcome to Monmouth in Focus, a comprehensive look at Monmouth County, the place you want to be. Monmouth County is centrally located in the state with 27 miles of Atlantic Ocean shoreline, nationally recognized parks, state-of-the-art libraries, school systems, and public services. Monmouth County is home to more than 660,000 residents. It's a great place to work and live. Monmouth in Focus will highlight county services that are readily available to you as a Monmouth County resident. Thanks for joining us for Monmouth in Focus. You'll know why Monmouth County is the place you want to be.
Hello and welcome to Monmouth in Focus, a program about the services and functions of Monmouth County government. I'm Cynthia Scott, your host for this segment of Monmouth in Focus. Our topic today is feeding the hungry and how we can all help in that effort. This year, Freeholder Director John Curley has asked the county to take a more proactive role to help collect food for our local pantries and soup kitchens. The result is a partnership to collect food through a very unique program that only the county could do. Joining me today are Freeholder Director John Curley and the new Executive Director of the FoodBank of Monmouth and Ocean Counties, Carlos M. Rodriguez. Thanks so much for joining us and welcome to have you on Monmouth in Focus. Carlos.
Thank you for
Freeholder
having
Director,
us.
always a pleasure to have you on the show.
With you, Cynthia.
Carlos, let's start with you. The food bank has been around since the 1980s, and it went from supplying like 100,000 pounds of food the first year to almost 7 million pounds presently. You know, such a huge difference, but still, is that number ever enough?
Well, you know, last year we served just about 130,000 people, 85,000 of which were right here in Monmouth County. And they came through a network of food pantries, soup kitchens, and other programs. And this actually represents a 71% increase in demand since the recession started. So what we're seeing in the increase of pounds that we're distributing really is just us responding to the increase of need in our community.
Absolutely. Now, supplying food, emergency food, I would imagine, in essence. Who needs the emergency food?
It's emergency food, and what we're seeing is that many of the new people that we're serving are folks that were just unemployed very recently. They were formerly the middle class, and right now they're finding having to make difficult choices between putting food on the table or paying the utility bills or paying the rent or the mortgage.
Absolutely. A few years ago, you know, before the recession, those people weren't reaching out to the food banks. Now it's, you know, more and more common. Freeholder, let's talk about the county's role in the food bank. How did it get involved?
Well, I had received a call when I took over as the Freeholder Liaison to Human Services. Received a phone call from Senator Jennifer Beck, who is a very dear friend and a wonderful senator. She had told me that our food stamp program, was 3 months in arrear in Monmouth County. And I had a meeting scheduled with Charlie Brown and Kathy Weir from Human Services, Charlie being the executive director. And both of those individuals do a phenomenal job for us. But we sat down and found out that we were 3 months in arrear. We had gone from 2008 with 7,000 cases for food stamps to presently 17,000 and growing on a daily basis. So I declared at that point immediately a food stamp emergency. Our Human Service Department was getting calls, and our citizenry was not being telephoned back, and that was unacceptable. So I was able to get 5 part-time people to handle clerical and telephone work to help expedite the program.
Did you actually go down to the food bank and meet with people to say, how can we help?
Absolutely. I had a wonderful opportunity of meeting with Linda Keenan. That visit is where I met Carlos. We struck up a very strong friendship, the three of us. And, you know, so many people that don't qualify for food stamps turn to the food bank. And these, in many cases, are people that are our next-door neighbors. Yeah. And it's a very, very difficult crisis. It goes through the full gamut of society. And it's important for people to realize that it's not someone that you dream of. It could be a family member. It could be your neighbor.
Absolutely.
And we struck this relationship up and developed a program.
And the programs, the unique programs that the county offers through the food bank, can you tell us about them?
Well, prior to this, the library system, our Monmouth County library system, which quite frankly is the best in the state of New Jersey, and our library system had a 1-week program where they would have food for fines. And we had convinced the library to extend that to a 1-month period. So anyone that was behind with anything they've taken from the library, a book, whatever, that they could come in and bring a food, and the fine would be dissolved. It wouldn't be owed. But of course, I want to emphasize food for fines, but anyone can bring a non-perishable food item to any of our facilities.
So if you have a library fee, obviously not an astronomical one, you just bring in the food and you'll basically be absolved of the fee, correct?
Absolutely, absolutely.
And it's a 1-week program which was stretched to a month. Why the need to stretch it for a month? Is it basically what we've been talking about, the recession and just people needing, the food bank needing more food?
Absolutely. And as Carlos can tell you, the desperateness of individuals who had previously given to the food bank who are now asking for food. It puts them in a very precarious and embarrassing position.
Yeah.
But we felt that a 30-day period would, exceed any past goals that we had had.
And this is all during the month of April?
Yes, and it's all part of the emergency that I declared on hunger in Monmouth County.
Okay. Freeholder, basically it's going to work, again, during the month of April. It's all the branches throughout Monmouth County that will be participating, correct?
All 26 branches,
Okay.
Cynthia, will be participating. We also will have bins at our Human Service Building. We'll have at our Agriculture Building in Freehold Township. And they will all be available for drop-off.
Right. So you just, how does it work? You just put your overdue books in the drop-off bin, obviously, for the books, and then you donate.
Certainly. And then your food.
Right.
And, obviously show a clerk of the library
Exactly.
what you're doing,
yes,
and,
so that they can
receive
mark you
credit
off.
for that.
Absolutely. Okay. And again, Freeholder, a really good point. It's not just about, I owe money on my books and let me bring in, 12 cans of Campbell's soup to not pay the fine. It's about, even if you're taking your kids to the library one Saturday, go and, pick up something or, obviously non-perishable, right? Just to drop it off. You don't have to owe money. Just do it as a good deed.
Well, Cynthia, one of the finest homilies I ever heard was, help your fellow human being survive. And this is an opportunity for the citizens of Monmouth County to reach out to those in need. And, of course, county government is opening that door and providing the opportunity. We look at this month of April as being County Government Month, and that is healthy counties and healthy families.
Yeah.
And that's something we want to emphasize, and that's a relationship that Carlos has developed with myself and the Monmouth County Board of Freeholders.
Carlos, are there any specific foods that you're looking for?
We are looking for non-perishable food, and in keeping with the theme, think nutrition. So think items that are rich in high protein, can of tuna, can of salmon perhaps, canned vegetables are always a favorite. Peanut butter and jelly, very important as well. That's a food that's really important, especially for children.
Sure, canned fruit, cereal, things like that.
Cereal, pastas as well.
All right, and again, anyone can drop off the food at the libraries, correct?
Absolutely.
Tell us about the food bank and what kinds of facilities you actually have on site there.
Well, we have our food bank here in Monmouth is a 40,000 square foot facility, which is dedicated to sourcing food and then distributing food to a network of over 260 programs. We also have a refrigerator and a cooler, which allows us to bring in more perishable foods that are obviously higher in nutritional value. So we actually do quite a bit of distribution of fresh produce and vegetables, vegetables and fruits, I should say.
It's also important to note, Freeholder, that the drop-off sites at the library are the month of April, but we're also having drop-off sites at county buildings as well.
The Hall of Records, where my office and the Freeholder offices are, the Human Service Building in Freehold on Kolarsick Road, and also the Agriculture Building, which is on Kolarsick Road. And that gives us a broader-based venue. And as I said before, all 26 branches of our Monmouth County Library system.
The food bank also, it does more than just collect and distribute the food. How about the other programs, Carlos, that the food bank is passionately involved in?
Absolutely. So Freeholder Curley mentioned our food stamp program, and that's a very important program that we run. We do an outreach program helping families, many who never thought that they'd find themselves applying for this benefit. We help them apply and navigate through the system. We do that at about 22 different sites in Monmouth County. In addition to that, we have a free short-term job skills training program a culinary in the culinary arts, and we've helped employ a number of residents with this skill over the last couple of years, and we're just about to graduate another class very soon of another 8 students as well. And it's a 12-week course taught by a chef in our facility, and we're very proud of that program. But it just goes to show that we provide food for the immediate need, but we're looking at more longer-term solutions so that families can go out and purchase food the way you and I can purchase food and help the local economy in doing so.
It's also important that when it comes to donations and food drives and collections, that it doesn't just happen around Thanksgiving and Christmas and the big holidays throughout the year, because you do see an increase in donations. Obviously, the turkeys, you see the story on the news every year, and the canned goods throughout the holiday season. How do you drive that message home that, hey, during the summer, we may see a decrease in food. Everybody's busy at the beach or busy on vacation. Let's focus on those times of the year as well.
Well, this economic decline is 365 days a year, and it's going to take us a much longer period of time to come out of, to get people back to work. And, I'll yield that question to you as far as, what we need to do to emphasize.
Well, hunger doesn't have a holiday, that's for sure.
Yeah.
And this is a problem that we deal with every day of the week. And what we need is the community, opportunities like this to help raise awareness about the problem. And that it doesn't just happen during the holiday season, that it's something that we have to struggle with every day. And it's something that when helping the food bank, you might be helping your neighbor. So many today are the unemployed and the underemployed that make up every community in our county.
Sure. Carlos, you have a great staff there, and you also have a wonderful volunteer program. Can you tell us about the volunteer program?
Well, we really couldn't do this without volunteers. Starting from our board members, who are all volunteers, but of course, right down to the sort room, where these wonderful items that we get through this food drive will be sorted by volunteers who come in every day faithfully and help sort the food by different types of food group, put them into boxes, and help get them to the programs, the pantries and the soup kitchens throughout the county.
I have to say, whenever I walk into a food bank, whether it be the one in Monmouth or the one in Hillside, there's just something that comes over you when you walk, especially when you talk to certain people that are there that need the food. There's just something you want to give when you walk into a place like that, and it really is. It's all about giving and helping people out. Some great information there. Freeholder Director, always a pleasure. I thank you for joining us.
My pleasure.
Carlos, great effort here, and congratulations on your new position at the Food Bank of Monmouth and Ocean Counties.
Thank you.
All right, that is all the time we have for this segment of Monmouth in Focus. For more information about the Food Bank of Monmouth and Ocean Counties, you can log on to www.visitmonmouth.com. I'm Cynthia Scott.
How you doing? My name's Steve. My family's lived in this neighborhood for years. Recently, things got so tight, we had to go to our local food bank for help. I lost a lot of sleep worrying about what the neighbors might think. That is until I saw them there, too. How'd I do, Steve?
A little stiff. You could have done a little better.
What? Come on. I have an Academy Award.
Yeah, but not for playing me.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
This April, help fight hunger in Monmouth County. Donate at a county branch library. For more information, log on to visitmonmouth.com.
You realize that 49 million Americans struggle with hunger? That's 1 out of every 6 Americans. These people are around us every day. They're our friends, they're our coworkers, their kids go to school with our kids. Sometimes we're not even aware that they're struggling. This problem is closer than you think. So is the solution.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
Hi, my name's CJ. A few years ago, my father became seriously ill. I did what I could do before he passed, but it took its toll. I lost my job, my house. I'm getting back on my feet, but I don't know when there'll be food on the table. How'd I do, CJ?
We could be twins.
Well, cousins, maybe.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
Hello and welcome to Monmouth in Focus, a program about the services and functions of Monmouth County government. I'm Cynthia Scott, your host for this segment of Monmouth in Focus. Monmouth County government provides a wealth of services for its residents, and one of the very unique services is the Medical Reserve Corps. To tell us about the county's Medical Reserve Corps is Lisa Lee. She is the program coordinator, and Maria Kolarsick, a Medical Reserve Corps volunteer and a nurse practitioner. Thank you both so much for joining us. I appreciate you being here on Monmouth in Focus today. Lisa, let's start with you and just tell us about the Medical Reserve Corps. We all know the name, but what exactly is it?
Well, the Medical Reserve Corps, or the MRC as we like to call it, is a county-based group of volunteers, both medical as well as non-medical. There are folks like you and myself who are willing to use their time and their skills to help our county to promote healthy living, as well as to train and prepare to assist in major public health emergencies.
When we talk about emergencies, let's become more specific. H1N1, is that what the Medical Reserve Corps would participate in? Or?
Yes, definitely. We would activate and deploy the MRC in larger types of public health emergencies. Those are the kinds of things where our regular health department staff or the regular group of emergency responders would not have enough people to handle the situation. So, for example, as you said, H1N1, which was an outbreak in 2009, we actually deployed more than 80 volunteers who helped our health department give more than 17,000 vaccinations.
Wow. And Maria, you are a volunteer. Obviously, Maria has an extensive medical background. I would imagine that that's what most of the volunteers need, correct?
Well, yes, they don't have to be extensive as I am, but there's certainly, you can have different levels of medical volunteers.
Right, some sort of knowledge. When we talk about H1N1, you were very proactive in that. What exactly did you do as an MRC volunteer?
Well, for sure. I was involved in that 2009 H1N1, the pandemic response effort, initiated and deployed by the MRC. And the thing with that is that was so frightening. The community there was a huge fear level in the community just because this was a type of an influenza that really didn't target the infirm or the elderly. It really targeted a lot of our youth, or a lot of our young people. So the residents of New Jersey were just so happy that that MRC deployed the volunteers so that they had some, protection from this viral killer. I mean, some of the statistics alone in the United States that were put out by the CDC, the number of cases, these are 2010 statistics, so it was well after 2009 when they felt they could get all the numbers together. The total number of cases in the United States were 61 million people. Wow. And of that 61 million, between the years of 18 and 64 were 35 million. The deaths that year, also total deaths, were 12,470 total deaths. And again, that young age between 18 and 64, it was 9,570. So those are kind of, very, very staggering statistics. So I knew that there was the fear out there, and I knew at the time that, MRC would probably be deployed, which it did, and they would mobilize the volunteers. So when they contacted me, I was ready. I was more than ready to go out there and do what I could for the public and the whole effort. So I went to a local high school, and I volunteered my weekend, and I just immunized all day long. I arrived very early, and I immunized all day long, the pregnant women, the children, and people. And at the time, too, and correct me if I'm wrong, there was a short supply of the vaccine.
Yes.
So that was what created even more public fear at the time. So it was kind of quite an experience, a really unique event, and MRC did a tremendous job.
Yeah, I mean, it really was just such a concern. I mean, kids would have sniffles, and the doctor's office would be inundated. Do they have the swine flu? I think there was one point when, at one point, it became so crazed that they stopped even testing for the swine flu and just started treating you.
Right.
Because it just got to become just too much.
It was.
Right. As a nurse practitioner, how did that complement being a volunteer? Obviously, vaccinating and immunization, but also I would imagine just educating these people who were so scared.
Well, you did. You had to do a lot of education. You had to really allay a lot of fears that were there. Psychologically, they needed a lot of support, a lot of emotional support, especially a lot of these pregnant moms that were coming in. What I was able to do as a certified family nurse practitioner, I also hold my doctorate in nursing practice, I was able to really practice to the full scope of my profession. And what you want to do in this profession and across the board is really practice to the top of your license. Because in New Jersey, nurse practitioners are regulated by the Board of Nursing. So I was able to do that, and I've been in the medical field for well over 30 years, so I do have a lot of strong skill sets that I'm able to bring to the Medical Reserve Corps, and I think I was able to do that weekend with the H1N1. So what we need to do, what I'm able to do with my skill set is definitely, strong physical assessment skills, be able to make quick decisions, immunizing, suturing, wound care, whatever need be. On this particular event, it was the immunization. And certainly when I volunteered for the MRC, I had to do some educational training through the program. So that's what they provided for me. So I attended and participated in many of the sessions that MRC prepared me for.
And Lisa, obviously, as a volunteer, Maria is more than qualified, but there are other people that have health backgrounds, maybe not as a nurse practitioner. What are some of those other volunteers' backgrounds when it comes to EMTs or?
Oh yes, definitely. Actually, the Medical Reserve Corps, we're happy to accept any type of volunteer from any different type of medical background as well as non-medical. And whenever we deploy for any kind of an incident such as the H1N1 vaccination clinics, we also give our volunteers some just-in-time training. We try to give them a little bit of an overview of what to expect. So people don't have to come in feeling like they know exactly what they're going to do, because we have staff to kind of help them and assist them till they feel comfortable with their roles. But most of our medical professionals, they're really valuable because they already come in with all of those skill sets. So they're great at comforting the public and using their skills. But we have many folks who are administrators, IT professionals. We're looking for people who are language interpreters. We have such a diverse community here in Monmouth County that we really wanted a lot of different types of volunteers and their skills to help us.
How do you get involved if you want to be a volunteer?
It's very simple, actually. You could just go to our county website, which is www.visitmonmouth.com, or you can apply online to the state MRC registry. I believe you're going to list that website later on. It's www.njmrc.nj.gov.
There it is right now on the screen.
And all you need to do is fill out that online application. It will ask you whether or not you're a community volunteer, which means non-medical, or a healthcare professional. Fill out the application. It will come directly to me, and I will contact you to set up a face-to-face interview.
Okay, great. Now, Maria, as a nurse practitioner, you have obviously taken on initiative to raise awareness about the importance of being a nurse practitioner. Tell us about that.
Right. Well, what's interesting about this is when I first became aware of the MRC, it was after 9/11. So directly after 9/11, the day that actually hit, I started calling area hospitals, police stations, and asking what could I do as a medical professional to actually get out there and help what we expected would be many victims from that awful day. So they sent me down to Atlantic Highlands. They sent me down to the dock in Atlantic Highlands. They said, go down there and wait for the ferries to come over with, with the patients, victims of that day. So we were there, and we waited, and we waited, and we waited, and one person came over. And again, it was just such a tragedy. I just remember thinking, oh my goodness, this thing is so much worse than we even ever imagined. And from that, after that whole event is when I went searching and found, and I think, the MRC was developed because of that too, just because of this particular experience that I had, the MRC was developed as a result of that.
Wow.
Yeah, they realized that they needed volunteers to be in a network in advance so that if there were emergencies like this, we could quickly contact volunteers, know who they were, know their experience sets.
So it was created after 9/11 in 2002?
Yes, 2002. This is actually the 10-year anniversary of the Medical Reserve Corps.
Sure. And what went into creating it? I would imagine it started out small and has just blossomed.
Incredibly so. It started from like less than 10 units to now over 200,000 volunteers, almost 1,000 units across the U.S. In New Jersey alone, we have 26 units, almost one per county, and we have about 5,000 volunteers. But it's the heart of the volunteers. We have great people who are willing to help, and getting them signed up in advance makes all the difference.
And what role does the Surgeon General play in this?
We are actually based out of the U.S. Surgeon General's office. And so in non-emergency times, our volunteers, we support the 4 Surgeon General priorities, which are to decrease disease, to improve disease prevention, to improve health literacy, to strengthen preparedness and response, and also to decrease disparities among different people groups regarding public health.
Lisa, how many members of the MRC?
We currently have about 365 volunteers within our unit, so we have a great unit.
And do they have annual training, seminars, and all that?
We do. We try to have monthly trainings, everything running from CPR, AED classes to triage classes to different things that will help our volunteers be better prepared to deploy. And we have 5 core courses that we ask our volunteers to take.
And obviously, I guess whatever time the volunteers can put in,
exactly.
It all depends on what their availability is.
Yeah, they're not we don't mandate our volunteers to come. It's whenever they can give of their time. We appreciate that. So it's not like we're the Marine Corps, where people have to come in, but they're purely voluntary.
And that flexibility really was one of the things that was interested me, because I could still work full time. I still could do my job. And they offer a lot of evening programs. They offer a lot of weekend programs. Because and I had been very, very active up until I was going on to get my doctorate at UMDMJ, and this is, from being a nurse practitioner to being the doctorate. What we did for, one of our capstone projects, a colleague and one of my colleagues, Shamini Kolarsick, and myself, in addition to advisors, Dr. Estrada, Dr. Hyder, we developed this whole promotional campaign for, to increase the visibility of nurse practitioners in New Jersey, because a lot of people are still a little bit, confused as far as what their role is. So we developed a website, 5 phases. They can go on the website, npsgetit.com, and really find out what nurse practitioners are. And
there
that
it is
should
right
be
there.
up,
All
too.
right.
Okay.
Well, thank you so much for joining us. Really, the Medical Reserve Corps, really, to sum it up, in time of need, people do come together. So we thank you both for your efforts.
Thanks so much.
Thank you. That is all the time we have for this segment of Monmouth in Focus. I'm Cynthia Scott. Have a great day, everyone.